A great pleasure that I now can introduce our first speaker of the day. And our first speaker of the day is Dr. Alastair Cook, who's going to be speaking about priorities for 2022 and beyond. Alastair, I had the opportunity to see face-to-face for the first time this morning, although we've been working together since July 2020 when Alastair joined Scottish Government as Principal Medical Officer. Previously, he was MD in NHS North Lanarkshire and also Chair of the Royal College of Psychiatrists for Scotland between 2013 and 2017. So I want to make special welcome for Alastair today, and thank you very much for joining us for our meeting. Thank you.
Thank you, Andrew. And it is a pleasure to be out and about and actually seeing people. This is an auditorium for those that are seeing online. You can't see what I can see today, but it's a bank of chairs, which I have spoken in many times before. But the bank of chairs being empty gives it a very different atmosphere than what we're used to. Thank you very much for putting up that picture. But it is great to be here. We have had a very challenging 20 months, and of course how we adapt and navigate the next period is hugely important. I want to start this morning by giving apologies for the Minister for Social Care and Mental Wellbeing, Kevin Stewart, who was scheduled to attend this meeting this morning, but my understanding is that he's been called into a cabinet meeting this morning, which meant that he had to pull out at relatively short notice, which means that rather than me covering the bits that he hasn't covered, I'm trying to cover as much as I possibly can, but I'll try and do that relatively quickly. The research network and the mental health research network is hugely important for all of us, because it's through research that we begin to understand, to evaluate and improve what it is that we offer to people. And that's hugely important. And we do look to the research community, both for innovation, but also to give us the evidence that we need that helps us to generate and improve and create policy. As well as the evidence that we get through research, we need to be thinking about other sources of evidence and other sources of advice and support for the development of policy. So that would certainly include, and the Minister is really keen on supporting this, is the experience of people with lived experience and how they can input to the development of mental health policy and the ways forward. So as well as supporting our work with yourselves through the Research Network and through COVID with the Research Advisory Group, which Andrew very helpfully chaired for us, then we're also looking to develop things like lived experience panel. We're developing an Equality and Human Rights Forum, which has now met several times. And these are ways in which we will really broaden the input into the development of policy. In addition, within Scottish Government, we are expanding the role of professional advisors, so as well as the medical advice which is going in. We now have psychology advice, we have HP advice and nursing advice very much at the centre of all of this. So bringing this group of, I suppose, advisory areas together, so research, lived experience, professional advice, we hope that we'll get the most rounded support for the development of mental health policy as we go forward. Just over a year ago, Scottish Government published the Transition and Recovery Plan for mental health, our route map to try and get out of the COVID period. For the first time, that was a piece of work which really looked at the whole system. So starting to think about population mental health, about how people can access support at a low level and ready access to that support and advice within our communities, how people get quicker access to interventions across the piece, but also how we begin to improve the quality of specialist services. For me, the Transition Recovery Plan was a good prototype in that process of pulling that together. We really began to draw on these different the different areas that I've already talked about, so research, lived experience, and the wider communities in doing that. What's, I think, helpful with Transition Recovery Plan, and as we move forward into thinking about what happens in 2022, is that we're seeing some significant investment in mental health, but also a change in the public discourse around mental health, so that there's a greater discussion about how important mental health is across for everybody across the population, as opposed to focus on all the time on mental illness. But being backed by investment is hugely important. So within this year, we're seeing £120 million of investment across mental health and mental health services. But that needs to continue through the course, and there is a commitment within this government's plan and the programme for government to increase the proportion of frontline NHS spend to 10% on mental health by the end of this Parliament. That is a significant increase beyond that £120 million. So it does give us a huge opportunity to really begin to try and reshape things over this time. So I was having to think about, one of the commitments in Programme for Government is that we will look to renew and refresh the strategy for mental health in 2022. We were due a 5-year review of the 17 to 27 strategy at this point anyway. But I think given what we've been through over the last 20 months, this is a real opportunity to take a step back and think about what we think a new strategy for Scotland should look like going forward. And looking at today's programme, I think actually it reflects quite a lot of some of the areas that we would want to be concentrating on. So when we hear about Generation Scotland, thinking about that, how have things impacted across a wide range of population? We'll, in some of the talks, we'll think about the more vulnerable groups and people with higher needs. What's the impact been on those groups, and how can we reflect that in our strategy for 2022? Really importantly, we're going to talk a little bit today about the impact on staff. And I think as we move forward into 2022, that's an area where we need to put some focus. And also we're going to hear a little bit from Professor Carson later on about the impact on our neurology and how so some of the harder science, which is also really important in how we take this forward. I'm going to start just covering a couple of those relatively briefly, but just to think a little bit about the staff support elements first of all, because without good support for the people who are working in our services, then we're really going to struggle to take any of this forward. Through the pandemic, there has been quite a big increase in the range of supports that are available for both health and social care staff across Scotland. And we want to see that not just as something for the pandemic, but as something we want to build on over the course of the next few years. And that ranges from good information and advice available through for self-help and self-support and digital offerings, through to an increase in support at health board level with clinical psychology services there. And an area where I have a specific interest is the development of what's called a workforce specialist service. And the workforce specialist service is a tailored mental health service for regulated staff working within health and social care within Scotland. This is something which I think has been missing for some time across Scotland, and something that a number of us have tried quite hard to work for a number of years. Currently, the workforce specialist service is being offered by Practitioner Health in England, and we have a contract with them, and through digital means, we've just done an analysis of the first 100 referrals into that service, and showing really positive outcomes for those who have been referred. We're close to 200 referrals now, as far as I'm aware, in terms of the numbers who have been through the service already. But we're about to launch a national strategic network to support WSS and its development in Scotland, so that hopefully probably, I would think, towards the end of next year, we'll start to see the development of a Scottish workforce specialist service to support health and social care staff across Scotland. In terms of other big priorities within the 22 strategy, I think we very much have to be about thinking about the whole system. And I've mentioned the sort of layers that there are within the transition recovery plan of population health, ready access to supports. One of the big areas for development that I think will make a big difference is that of primary care mental health. We know how much things are pressured and how people are struggling within primary care at the moment, and how difficult things are for general practice. The GMS contract introduced in 2018 offers an opportunity for us to shift towards more multidisciplinary working within primary care teams. And rather than us think about the old way of working, which was always where a mental health issue or problem was identified in primary care, then that required a referral to a mental health service. Where we want to try and get to is that primary care actually has the capacity to be able to assess and to treat a lot of the mental health problems that are presented within that primary care setting. So the work on primary care mental health envisages groups of practices or clusters of practices having multidisciplinary teams, probably in the region of 8-10 staff per cluster of practices, who are able to offer a whole range of things, being from psychological inputs through link working, through assessment and some levels of treatment. And those will be managed within that primary care setting. That will be backed by investment over the course of this Parliament. So that will be rising investment. So we'll kick that off very, very soon, and that will be announced soon. It'll also be supported by the developments. So there was an announcement just a week past Friday around money which is for grassroots community developments, so that if we have link workers within primary care, there are actually things for them to link to, and that we have a big expansion in community supports that are available there. We're going to do some work around supporting the most vulnerable in our society. There's a lot, I think as we go into the strategy 2022, then trauma and trauma-informed practice will very much be at the heart and the centre of that. Thinking about people who have complex psychosocial needs, not necessarily a diagnosis of a specific mental health problem, will also be an area where we'll want to do some work. And really focusing on groups who have traditionally been those that are less well served by mental health services, those that are perhaps feel harder to reach, or less engaged in services. In addition to all of that, then we also need to think about specialist services. What do we really want secondary care mental health services to look like going forward? There's some work that we're beginning to do, which I think will begin to shape that. So, for instance, we have the project that we're working on, early intervention in psychosis. And the development of that early intervention model, I think, will have a lot to teach us about what we need to do, not just for those in the first 2 or 3 years of a diagnosis of psychosis, but going forward, how we use some of the principles that are there for the whole life span for people with psychosis. And similarly, we're going to be doing some work to really look at what's the best offering we can do for people with personality disorder within our population. All of this, I think, gives us an opportunity over the course of this Parliament to be thinking about how we reimagine what the role of the CMHT is, and how our mental health system can come out of this next period of investment, development, thinking and strategy looking quite different than it does just now. All of this is going to require evaluation, more innovation, and I think really look forward to working with the research community to help both direct where some of this is going, but also to evaluate and help us to figure out actually which bits are working and not working. I think it's going to be an exciting few years, and I'm very much looking forward to working with all of you over that period. So, thank you.
Alastair. Thank you very much indeed. And it really is very good to be face to face after such
Indeed.
a long time. I'd like to maybe start by asking a question. One of the important, I suppose, achievements over the last year has been the way in which health services and mental health services have pivoted from face-to-face to delivery online, and now we're moving back to a different position where I guess maybe health services will begin to look a bit different. And I wonder if you could comment a little on digital and
Sure.
maybe if there's a vision for digital.
Yeah. So I think the change that we've introduced, it's quite easy to forget how much change we've actually made over this period, and we've got so used, I think, some of us, to working digitally. I mean, it's slightly odd actually to be in a room with other people today and not just be doing the head and shoulders thing and seeing everything on Teams. So for some of us, that has become so much the norm that actually it's quite easy to forget that it is such a change. For me, I think that we've got to have some caveats about digital, but the potential advantages for more use of digital are huge. So it will, I think, for a lot of people, make getting to appointments, managing appointments much easier. But we need to be absolutely clear about how we give people choice. So some people will prefer to do face-to-face, and I think we need to be able to give them that option. For some people, we know that there's been a great deal of exclusion from services through greater use of digital over the course of this period. So we've got a bit of catching up to do with that group, I think, and how we manage that. There are exciting things, though. So, for instance, I think the greater confidence that we have around the use of digital means that things like, and in my head this is, so if I'm in a remote and rural area and I need very specialist support, so eating disorder, perinatal, some of these less common issues, then I can now potentially get that where I am, rather than having to travel to a very specialist centre to get that support. So those sorts of innovations, I think we were beginning to see glimmers of it before the pandemic, but there's really now, I think the confidence has been developed around that. So I think that's quite exciting, but we've always got to have that caveat about how we try and deal with people's preferences and their abilities.
Thank you very much, Alastair.
You're welcome.
We have online Q&A, and we have one question from the Q&A and online. It's from Eileen Hay, who's asking, have there been any discussions regarding the 65 rule where service users automatically move on to older people's services?
There have been some discussions about it. I mean, I think we probably will try and address this within the strategy. This is not something that is universal across Scotland. Services have chosen different ways of addressing age of discrimination effectively through this way. And I think we would like to move to mandating away from age-related barriers like that. There are practical reasons why that has been introduced, but I think if we can try and move towards more needs-based decisions about what the appropriate services are, then that would be very helpful. But certainly, I mean, in the services where I've worked, we moved away from that arbitrary cut-off some time ago, but I think that is not the case across all of Scotland, and perhaps the strategy will be an opportunity to begin to address some of that.
Thank you very much, Alastair, and thank you very much, Aileen, for the question. Thank you.
Thank you.